All right, so the country's largest school system halts in-person learning once again due to rising cases of COVID-19. New York City Mayor Bill de Blasio announced yesterday that residents have tested positive at a rate of 3% over the past 7 days, surpassing the threshold set for school shutdowns. Roughly 300,000 children had been attending classes in person in New York City for just under 8 weeks, and now they're all back to remote learning. So Michael Mulgrew is the president of the United Federation of Teachers, the union which represents city school teachers, and he's joining us now, and I really appreciate it, Michael. So a lot of people are going to say, oh, you're focusing so much on New York, but it's the largest school system district in the country, and often, you know, other smaller districts look to see how New York is handling bigger problems. And so I know that this 3% rate was what the city and the school district had been focusing on in terms of transmission rate inside the community. But there was some confusion yesterday over the different test results data Mayor de Blasio and New York Governor Andrew Cuomo were coming up with and giving to the public. What data does the New York public school system rely on, and how did New York City and the teachers union decide on 3% to be the standard, the threshold?
Right now, our state and city are using a different set of metrics, and we would hope that they could get that resolved and use one set of metrics because it's confusing. In New York City, we are now currently using the city's data. That is what the city agreed to use when we were putting our plan together, because we are the only large school system that has opened. And we are actually the largest schools. We were hit harder than anybody else in March and April. In terms of deaths of our members and all sorts of other things. I would hope that the city and state would get together with one set of metrics because it's confusing. And it's not like one is always higher than the other. They go back and forth. The 3% was the city's idea. They came to us with the 3%. Our main concern was social distancing, masks, mandated testing of students and staff in schools. We followed what independent medical epidemiologists were guiding us through at that point in time because we said we wanted to open. We thought it was important, and the teachers and their union fought and worked really hard to get our school system open. And now we're facing this dilemma of moving back up in terms of positivity, as you were just reporting. And I was with the doctors on Tuesday for quite some time, and they're focusing on Thanksgiving. And they're really putting out a warning sign to everyone that there is light at the end of this tunnel, but we're about to go into our toughest test as a country between Thanksgiving and basically April 1st. And how we deal with that is going to be really determine how many more lives that we lose.
Right, but sir, the positivity rate for the school population is below 1%. We just showed a graphic. It's actually 0.23%. On CBS this morning, our colleague Tony DeCopo asked Mayor Bill de Blasio why he's sticking to that 3% number. I want to play that for our audience.
Because we were the epicenter of this crisis. Everyone knows that. We needed to bring our schools back in the fall, and we needed to show parents and staff that they'd be safe. So we set a very stringent standard. And a whole lot of other health and safety standards, the distancing, the face mask for everyone, kids and adults alike. And we proved that schools would be safe. But we said if that rate went up higher, we were going to stop, we were going to pause and reset. Our schools are going to come back, but they're going to come back with additional safety standards.
All the doctors that we've spoken to say, that it makes no sense to close the schools because that is not where the increase in infections is happening. And so I guess I would like you to explain to parents, especially parents who had less than 24 hours to figure out what to do with their children, the parents that may not be in the financial positions to be able to hire somebody to watch their kids if they need to go to work, why schools should be closing if the testing rate is much lower than that of the city as a whole, and especially, and I know this is not your responsibility, but you know, people are going to see bars and restaurants that are still open and yet schools are closed. That is where the spread is happening.
That's the frustrating part for us. We believe that there should be a tightening in any geographic area. Originally, when we were discussing this plan in August, we had put on the table that we could do a geographic zones versus the entire city, and the city said they prefer to do the entire city. So for us, this is also very frustrating because we're the ones who actually really worked hard to get our school system open. So I want to be clear about the doctor issue you just brought up. We always knew that our school buildings would be the safest building inside of each community, because we knew that if those rules would be followed, that would keep the test results down inside of the schools. But we were also warned very, very pointedly by the doctors we were working with that if a community around the school, the testing results start to go up, it's just a matter of time before it tips into the school, and then the school will become the vehicle for spreading the virus throughout different neighborhoods. So I hear what you're saying with your doctors, but when you put it into context of what we did, I believe there should be a geographic approach, not a citywide approach. And I'm hoping now that as long as we can keep this virus down, I'm hoping that between Thanksgiving and Christmas, we plateau and push it back down. Because if we get up to 6 or 7%, this whole conversation is moot. Because then we know that it's not just going to be schools, it's going to be a lot more of a lockdown. And we're hoping, because we've done this in New York City, we did put this virus at bay. I know the teachers were doing their jobs inside of the schools. You can see that with the results. But it's not just about us. It's got to be everyone working together.
So listen, when this pandemic forced the closure of schools in the springtime, many districts were caught off guard, trying to sort of scramble together this idea of remote learning. We have more time now. I know parents are really concerned about whether or not this is just going to turn out to be a lost year for their kids. Do you think that the school district is better able to handle remote learning now? Will there be a higher quality of learning happening this time around?
It'll be a higher quality, but I'm frustrated that more could have been done by the school district. Our focus was clearly on safety.